Hello parents, welcome to our Ask the Expert session. Today we are happy to welcome back Dr. Anjali Kumar, who is an obstetrician and a gynecologist with more than 26 years of experience. She is the chairperson and head of department gynecology and obstetrics at Artemis Hospital, Gurgaon, and she is also a director of the Gyne Clinic. She has done groundbreaking work in our field and we are very privileged and grateful to have her with us. Welcome to the session, Dr. Kumar, and thank you so much for taking the time out for us.
My pleasure.
As we all know, pollution is becoming a big problem in cities. In fact, as we speak, in number of cities in North India, the air quality ranges from very poor to severe to hazardous. How does one stay safe when pollution is as bad? And this question becomes even more critical for ladies who are either planning a family or are expecting their first child. So today we will be taking up questions regarding this issue, and we'll request Dr. Kumar to please give us advice and suggestions to stay safe and healthy from pollution. Before we get to the questions, Dr. Kumar, first I want to understand how pollution impacts an unborn child. For very small children and elderly, we know their immune system may not be 100% and it impacts them. But for a child who's not even born, how does pollution impact the baby?
Yes. All of us know that pollution is bad. It actually affects everyone in the society. Of course, there are sections of society which are more vulnerable, like you said, the young children and the elderly, and of course, the pregnant women. Now, the pollution basically comprises of a lot of things like suspended particles, the aerosol, the dust, the smoke, the ozone, and the dangerous gases like carbon monoxide and sulfur dioxide and so on. You know, the particles which are less than 2.5 microns, now these are known as PM 2.5, right? Now these are very, very small particles. They are so small that they cannot be even seen by naked eye. Now when you inhale air and there is, let's say, good amount of PM 2.5 inside it. Now these small particles, they enter the lungs, they enter the bloodstream, and from there they can actually enter the cell membrane. They can actually and practically enter every cell. They have the capacity to even cross the placental barrier, which means, there is something which is known as placenta, which is a connection between the mother and the baby. So these particles actually can cross the placental barrier and can go inside the baby. They can actually cross the blood-brain barrier of the mother and the baby both and cause a lot of problems. So how they cause problems is basically all these pollutants, they lead to formation of what is known as free radicals in the body. Now free radicals are basically the culprits behind so many problems in our body. So these are the things which cause acute and chronic inflammation. The biggest worry is that they can cause what is known as a neuroinflammation, which means inside the brain, our nerve cells, the neurons, they can get affected by all this. So there have been a lot of studies where it has been found that when pregnant women were exposed to, dangerously high levels of pollution, there was high chance of autism in the babies, high chances of schizophrenia in the babies, even cognition was affected, which means, the IQ levels, the problem solving capabilities, things like attention deficit disorders, and, basically the child becomes very anxious, overactive. Until now, we practically don't have an answer to all this. And somehow pollution may be the reason. We really don't know.
Right, so it is a very serious issue for expectant mothers and you must take precautions. We will discuss what you can do. Let's get started with your questions. Poonam has sent us a question. She's saying, I'm expecting my first child soon and I used to go for walks to stay fit for normal birth. However, now I cannot do this because of pollution. What are the indoor exercises I can do instead?
So yes, Poonam, very good is that you are aware about being fit and active in the pregnancy. It's very nice. But yes, unfortunately, because of the pollution, we all are practically, restricted to our enclosed, places, whether it is home or offices or whatever. So yes, of course, you must avoid going outside, and especially if at all you wish to go outside, the best time actually is to go in the afternoon time, which is roughly between 12 to 4, which is when the air quality is slightly better. And also, I want to tell all of you that we all tend to think that inside we are safe, but actually, it's not really true. The inside air may be actually dirtier than what we expect. Now, this may sound very scary, but that's how it is, because practically there's no movement in the house. And so we must take precautions even inside. Now, what precautions we can take? Of course, using the air purifiers and a lot of other things. But since you asked about the exercises, so I would say walking around in the house, number one. So make sure that you walk around in the house. If you have stairs, go up and down the stairs. That's also very simple, safe exercise. Try and involve yourself in all kind of home activities. Generally, we all have helps at home. So I would say, since you're not able to go out and involve yourself in the outdoor activities, make sure that you at least involve yourself in the normal household activities. And you can do good prenatal yoga. Now, yoga is something which does not need a fancy equipment or a fancy gym. You just need a good mat. The only advice which I would want you to be aware of is that never do yoga just looking at a YouTube video, or maybe just a DVD or whatever. Make sure that you have an access to a good prenatal yoga instructor, because yoga for a pregnant woman is a little different from a person who normally does the yoga. So with little modifications and good instructions and help from a good instructor, yoga is a wonderful exercise which will keep you fit in pregnancy and actually can prepare you for labor and can make you happy and peaceful and relax and all those things.
All right. So try yoga, but with an instructor.
Absolutely.
The next question is coming in from Priyanka. She says, I'm in my second trimester and I step out for work and other errands. What are the precautions that I should take to guard myself and the unborn baby against the pollution?
So like, the last question we spoke about, if at all you need to go out, make sure that you're going out, when
at a good time.
Especially afternoon levels. Make sure that you avoid going to places which are heavily congested, like, for example, heavy traffic areas. And always, like I said even previously, make sure that you read, like today is a bad day, tomorrow is a little better day. So, if you
Plan
can plan your activities for a day when the weather is slightly better, then, that would be better. And whenever you can avoid, especially in this season, make sure that you stay indoors
and wear a mask. I think a mask.
Yes, of course. Wearing a mask also helps. Yeah.
So next question is coming from Shruti. She says, I've just had my first baby and she's 2 weeks old. How do I protect her from the adverse effects of pollution? I think why she is concerned is because when you have such a small child, you may want to keep the child indoors, but sometimes you have to go for vaccination and doctor visits. What does one do with such a small baby?
Absolutely. So, first thing is avoid going out, with a small baby, even, putting masks also is not a practical solution, because the child is going to be very, very uncomfortable. So, if at all, you may have to go, plan your visit at a time which is in the afternoon, talk to the, pediatricians. I'm sure, they would be happy to help you that way. And, so stay indoors as much as possible.
I think you should just avoid, non-essential travel, like going to the market. I see
absolutely.
Some parents take very small children to markets and crowded areas. I think that is the most avoidable thing at this time.
Absolutely, especially in this time when, things are very bad. So it's good to be cautious. Absolutely.
And stay indoors and get a good air purifier as well to keep the child safe. We have the next question coming in from Deepa. My husband and I are planning to have a child. I want to know how pollution impacts me, and will it affect my baby if I conceive now?
So, like I said, we need to be aware that pollution impacts everyone, all of us, which includes me, she, your husband, you, unborn child, everyone. We need to be aware of this big problem. We need to be, taking steps at our level too. Yes, of course, pollution is a big problem. It has, short-term problems. It has long-term problems. I mean, short-term problems, simple problems like it can cause eye infection, eye irritation, sinus irritation,
breathlessness.
People may have more bronchitis and allergic attacks or the asthma. Long term, it can cause emphysema, COPD, it's chronic obstructive pulmonary disease, shortness of breath, lung cancers, chronic fatigue. I mean, if I have to enumerate, it looks very, very scary. But so having said that, I would not say that, of course, don't plan. Of course, I mean, we all have to do things.
Yeah. Yes.
But pollution is something which you and I really do not have a major control on. Of course, nowadays there's so much of discussion on to what are the causes of pollution, what the government has to do to curtail the bigger amount of pollution. So, of course, irrespective, we have to go on with our lives. You have to plan a baby. Like I said, pollution is not in your hand now, but make sure that other things are fine. Make sure that you go to the doctor, get yourself examined for other problems. The doctor would do preconception tests, would advise you to take folic acid. At least make sure that you are in best of health before you plan a baby, so that the effects of pollution are minimized. So.
But maybe she's asking this question as far as timing is concerned. But you pointed out that, timing is not important. Pollution is a problem year-round.
Yes, absolutely. I think probably in our country, we get used to things ki, okay, thoda better hai, but, we need to be demanding. We want good. We don't want better. So.
And you have to be vigilant around the year.
Yes, we need to be vigilant, and of course doing our own bit also. Things like planting trees around our house and our colonies, keeping indoor plants, making sure, there are no unnecessary activities like, even simple things like burning incense sticks, burning candles. They all lead to accumulation of SPM, which is suspended particulate matter. So, whatever little things which we can do at our end, definitely they are going to help.
Definitely, there are many things we can ourselves do to try and reduce this problem. But one must not put off their life goals or their lives.
I mean, life has to go on, and
you can go ahead, just be more vigilant. Now we have a question coming in from Sonal. Are there any foods that can be taken during pregnancy to tackle the adverse effect of pollution on pregnant women?
Okay, so like I was saying, pollution causes, it generates free radicals in the body and basically leads to chronic inflammation. So, if you take a diet which is rich in antioxidants, now antioxidants are basically the class of nutrients which can counter the effect of free radicals. So, taking vitamin C rich foods, vitamin E rich food, the food which contains beta carotene, lycopene, omega-3 fatty acids. So, if I have to medically make a list, it will be a little long, but just to give you an idea, all green leafy vegetables, all fresh fruits and, vegetables, especially the citrus fruits like lemon and oranges and amla and guava, and green leafy vegetables, like spinach, lettuce and amaranth and kale. And methi, yes. In fact, there's something known as, all Indians know this, it's called cholai ka saag. It's called amaranth. It's actually very, very rich in antioxidants. So one positive thing is that in these months, we have access to at least good green vegetables. So make sure that you use them. Omega-3 fatty acids, so most of the nuts contain it, like, for example, walnuts, the chia seeds and flax seeds and sunflower seeds. So,
incorporate
make
seeds
sure
into your diet.
Yes. And one more thing which I want to tell you is that make sure that you drink a lot of water. In winters, we tend to actually drink less water. So please drink a lot of water. And if you can, drink lots of warm water. Water is something which actually flushes out all the toxins.
Toxins.
So make sure that you drink a lot of water.
Right. For non-vegetarians, what do you think fish is a good source of
Yes, of
omega-3s?
course. Yes. So things like salmon and eel, yes, fish is a good source of omega-3 fatty
There's
acids.
a belief that gur helps against pollution.
Yes, very much. I actually forgot about it. In fact, it's there in our, ancient culture and tradition to use a lot of jaggery. So, in fact, Ayurveda also mentions it. I'm an allopathic doctor, but yes, this is something which has been passed on to us from our mothers and grandmothers, that using a lot of jaggery, using a lot of ghee, using things like cardamom, tulsi, ginger, onion juice, all these things are actually good. And in fact, using a lot of turmeric. So I tell this to all my patients is that have healthy milk. Unfortunately, Starbucks popularize it as
The
turmeric latte, right?
latte.
So now it has
Caught
on, and unfortunately
When our
we've
grandmoms
forgotten
would
our
say,
healthy
we'd say,
milk.
who'll have that healthy milk? But now it's fashionable to have healthy milk.
Absolutely. So make sure that you use fresh turmeric, not the powder one. Fresh turmeric, grind it, put it in milk. Maybe you can add some peppercorns, a little bit of jaggery, and it makes a wonderful drink.
Definitely. Next question is from Raki. She says, I'm 20 weeks pregnant and recently I started feeling a shortness of breath. What can I do to become okay?
Okay, so number one, the shortness of breath is also common in pregnancy. So even if pollution is there or not there, many people experience shortness of breath. But considering the scenario now, and we're talking about the pollution, yes, of course, you need to be taking all the precautions which we just now spoke about. And in case the shortness of breath still does not become better, you need to report to your doctor. This is very important. Just don't think, okay, it's because of pollution. So please report to the doctor in case things are not manageable at home.
All right. Next, we have a question from Aishwarya. She says, I'm in my second trimester and I'm noticing that sometimes my gums bleed. Is this normal? Some people even have severe dental problems with infections in their teeth. So what can be done in such a situation?
So number one, the gum bleeding is normal in pregnancy. So, the hypertrophy of the gums, where the gums become swollen, is normal in pregnancy. So a little bit of bleeding sometimes, especially when you brush your teeth, is fine. But in case it's becoming repeated, and in case it is associated with some kind of a bad odor and pain, you must visit a dental doctor. And contrary to what people think, all dental procedures can be done in pregnancy. In fact, we always advise people to undergo one good dental checkup in pregnancy.
To rule out any of these
dental infections are known to be one big reason of preterm labor.
I didn't know that. So checkup during pregnancy is a good idea in that case.
Yes, absolutely. One good dental checkup in pregnancy is a good idea.
All right. Manisha sends us this question. She says, I'm in my 9th month of pregnancy. Sometimes I notice a discharge. Is it normal? And when should I consult my doctor?
Okay, so in pregnancy, because of hormonal changes, there is a lot of, discharge because of the stimulation of the vaginal glands and the cervical glands. So you will notice that many times your undergarments get wet, but typically it's a mucoid sticky discharge. But in case you ever think that this discharge is, maybe foul smelling, or it is curdy white, or it is reddish, greenish, or yellowish in color, these are actually signs of infection, and you must report your doctor. In 9th month, in case you notice a discharge which is watery, it could be a sign that probably your water has, broken. So.
And you're in labor?
Maybe, yes, of course. 9th month, in case we're talking of a discharge, as a gynecologist, I'm only worried about one thing, that the water bag hasn't broken. So please visit a doctor.
Right. Stay safe. Visit your doctor. Sumit has sent us this question. My wife has just delivered our baby via C-sec. What are some of the precautions that should be followed for quicker healing or safer healing?
Okay, so the tissues, by the way, they heal on their own. You don't have to do anything special to make them heal faster. It's a natural course of events and the body follows its course very well. The only thing which you can do is that you have to make sure that you keep that area dry and clean so that there are no infections there. Otherwise, you don't have to take a fancy medicine or a fancy food to make it heal faster. You just have to keep it clean and dry.
Okay, so body will heal on its own.
Yes.
Deepti's question is, I'm in my first trimester. What are the precautions I should take to ensure the well-being of my baby during this time, the first trimester?
Not really. I mean, you see, first trimester, you just need to take folic acid. You just need to be avoiding some high intensity strenuous activities. Normal routine activities in the house and the office are absolutely permitted. And make
Eating
sure
a
that
healthy
you eat a healthy diet, and you visit your doctor frequently. They would do certain tests, maybe ask for an ultrasound. If things are fine, you actually don't need anything fancy. I always tell this to people that pregnancy is a very natural and a normal event in a woman's life, and we must let it remain normal, simple, and physiological. We should not mess around too much.
All right. Now, Sangeeta has sent us this question. We're planning a baby moon, and my wife is in the second trimester. Are there any precautions to be taken during this time? I think the question pertains to travel during the second trimester.
Yeah.
Is it safe, and any precautions?
So any kind of a travel or vacation is okay. Actually, the second trimester is the safest. It's actually supposed to be the golden time in pregnancy where all the discomforts of the first trimester are not there. The bulkiness of the third trimester is not yet started. So you're pretty comfortable. And this is the time when things are pretty stabilized and you can go in for a vacation. Most of the air journeys are safe. The air travels are safe. Even the train journey is safe. I mean, you just have to make sure that you're not lifting very heavy weights. Don't go for some really adventurous activities, but simple chilled out holiday anywhere is okay and pretty safe. Yeah.
Sneha is sending us questions. She says, I'm in my second trimester and my belly has started to grow. Winters and stretching are making my skin itchy. What are good remedies? I think this, even if many women have problems with itchy skin during pregnancy, whatever be the weather, what can be done? What would you recommend?
So the best is to use any kind of a moisturizer or cream which you normally use. I generally tell people don't use anything new and fancy. For that matter, you can even use a normal virgin coconut oil. Actually, that's one of the best remedies for it. Even the simple ghee which you make at home is one of the best and the simple things to apply on your skin. Resist the temptation of using something fancy. I've seen people coming to us with so many allergies, using a product which they never used, and they thought probably, they would have some kind of, maybe they would have some very nice skin or something. And I've seen allergies developing after using some kind of a fancy product. So stay safe.
Right. Meena is asking, what foods should be avoided during pregnancy?
Now, by and large, you can practically eat everything. There are only few things which I recommend they should not be eating. So number one is no caffeine. So basically no coffee, not even caffeinated drinks like Coke, Pepsi, Thumbs Up.
Tea?
And tea is fine. I mean, most of the tea which we normally eat they are non-caffeinated tea. So tea is fine. And anything which contains MSG. MSG is monosodium glutamate, commonly known as Ajinomoto. And then no alcohol, absolutely no. People ask me, wine, beer, whatever. So no alcohol in pregnancy at all. And no smoking, whether it is active or passive. So we're talking about the pollution, so make sure that there's no indoor pollution like smoking and all. In fact, there are so many myths regarding so many fruits and vegetables. By and large, they are absolutely safe. Stay away from packaged food, refined food, processed food, junk food. We must all learn to relish our homemade food.
And wholesome food.
What
about some foods like papaya and anar? Because some doctors feel that it can trigger prostaglandins and send you into labor prematurely. What do you think about that?
none of our medical books, anything, really mention about if you take papaya, the person will go into labor. Now, it has been said that the latex of a raw papaya is known to induce contractions in some animal models.
Okay.
Now, here we've taken it really far.
Okay.
Right?
So there's no study to prove this.
Yes, absolutely. None of our medical books ever mention about anything about poor papaya. So, I mean, of course, so medically there's nothing, but in case you are too skeptical about it, obviously, you know.
Skip it.
Yeah, skip it.
Anusha asks, is it true that soothing music helps the growth of the baby during pregnancy?
I think everybody likes soothing music. So, again, we do not have a scientific data as to what kind of music and what intensity or decibel or what sort of a music will affect. But yes, like all of us, the babies also love to listen to good music. And we have scientific data to prove that beyond 22 to 24 weeks, the baby's sense organs, they start functioning. The babies can actually hear. So we have a lot of medical tests, whereby we can see if a particular sound is played. We can actually see the changes in baby's heart rate, and some experiments whereby a particular music was played to the mother and the baby became quiet or happy. So please go ahead and indulge yourself in whatever music you like, whether it is a peaceful rock music or whatever. But
whatever relaxes you.
Yeah, whatever relaxes you, keeps you happy, is good for your baby too.
So Dipanshi is asking, I'm 13 weeks pregnant and I have a desk job. What can I do to ensure that baby is healthy throughout this period? Plus another question, Bhavya is saying, I've always been active and I've been into running marathons. Now that I've conceived, is it safe for me to continue? So taking both these questions, when it comes to physical activity and betterment of your unborn child, what's your recommendation?
Yeah. So again, I tell this to all my patients that pregnancy is the most normal, most natural and physiological events in a woman's life. It is not that fragile as we think it to be. Moving around the house, going for physical activities never harms the baby. Had it been like this, poor people would never be able to have babies. I mean, there are so many women who've played, tournaments in pregnancy. They've run marathons. And we were talking about the yoga. I've seen women who actually can do a headstand in pregnancy. It all depends upon what was your fitness level before you got pregnant. I'm sure many of you would have heard Serena Williams actually won her French Open when she was 14 weeks pregnant. So she must have played a lot of matches before she actually won the final. So, but yes, of course, she was used to that kind of an activity. If somebody asks me, ma'am, I want to learn tennis in first trimester, obviously the answer would be no. But in case your body is used to that kind of an activity, with little bit of care and, vigilance, I'm sure you can play, but you can sort of continue to do whatever activities you have been doing. But make sure that you speak to your doctor. There are certain medical conditions like low-lying placenta, somebody who has a history of premature labor. So these are the situations where we ask people to exercise a little bit of restraint. But otherwise, for most of the people, you don't have to protect your pregnancy too much. God has made very nice safety mechanisms inside.
All right. Thank you so much, Doctor, for taking the time out and answering so many questions. With this, we have come to the end of the session. We hope you've enjoyed and learned a lot about how to manage your pregnancies when the situation in your environment may not be very conducive. All these tips will prove to be very beneficial for expectant mothers and those planning their families. Thank you so much for taking the time out, Dr. Kumar. I hope you've enjoyed the Q&A session, and we'll be back soon with more questions from your side. So keep sending them in and our experts will be happy to answer them.